Hey,
Mm.
Katie.
You're on mute, Dr. Richardson. Hey, Katie.
Good morning. I was telling Linda congratulations on her big grant, but then I was on mute. So
it,
I'll say it again.
it was a group effort for sure.
Well, that's still, I'm excited to see what that opens up and allows you to do.
Yeah, we're super excited.
Congratulations, Councilman Shealy, on your reelection.
Thank you. I appreciate that. Thank you so much.
Councilman Shealy and Paul Avery Crimes just joined. And I'd let Paul know, but she's a recent graduate from Furman University and is interested in public health. So I invited her to sit in today with us.
Thank
Great.
you for
Glad to have
having
you,
me.
Avery. Yeah, thank you for being with us.
And Kevin, we are live.
Okay, well, good morning, everyone. I want to welcome all of you to our Health and Wellness Committee meeting for November 5th, 2025. It's 8:30 a.m. And I want to thank you for sharing your commitment to improving the health and wellness of the city of Charleston. And gosh, it's November, y'all, a month when we begin to think of so many things we're thankful for. We start looking forward to the upcoming holidays with family and friends. And gosh, we got a beautiful week this week, a beautiful weekend coming up to enjoy. I appreciate you taking an hour of your time to join us to make our community healthier. I do want to remind you that we're streaming on YouTube on the City of Charleston YouTube channel. And Paul's got some slides that we've got some events coming up. I'm going to turn it over to Dr. Richardson, if she would tell us a little bit about a couple of these things that she shared with us that's coming up.
Absolutely. Thank you. Thanks for having me. Um, Paul, do you want to share the events first, or do you
I'm
want me
I,
to
I'm
start
trying
with
to.
measles, or what do you think?
Well, since I had them on a there it is. Since I have them on a document, why don't we go ahead and do that, and then we can just go from there.
That sounds great. So we have a very active community engagement team here in the Low Country region, and I'm grateful to them for sharing with me to share with you every month some of the events happening in our area. So these are, I think, in order of when they're happening this month. The Coastal Blooms is hosting a Harvest Hooray on the 1st from 11 to 1. We will be there offering public health information, and there'll be a variety of other services there, including food donations, which we know is such a big issue right now with SNAP still on hold. The next one, I think, is
Is
maybe from Jonathan.
Yeah, Jonathan Kessler, are you on?
I am, yes. The
Great.
23rd annual tribute to veterans in North Charleston being held at the North Charleston Performing Arts Center. Excuse me. It's going to be a wonderful event. It brings out a lot of veterans, their supporters, and vendors, providing free services and resources for the Low Country. And of course, November 11th is Veterans Day. So here at the Ralph A. Johnson VA Medical Center, that is our passion, and that is the population in which we serve. So it's a really important month for so many reasons, but for that particular reason in general. So if you have an opportunity, if we could at least please do share the word. We'd love to see a great turnout again.
Great. Thank you.
And then on the 15th, there are two events providing food, including turkeys, as well as health screenings happening around the Charleston area. This one is in Adams Run, and the next one's at Stall High School. Yep, there it is. Stall High School's, this one's supported by Shifa Clinic. Dr. Khan has come and spoken to this group about chronic disease prevention. They have 500 turkeys to give away, as well as diapers and lots of fresh produce. There'll be flu vaccines, and vision screenings, as well as blood pressure and diabetes, testing, anemia testing. And then on the 22nd,
Wait a minute, you got one other one on the 15th.
yes, I do. Thank you. I didn't print that one, I guess. So National Injury Prevention Day celebration at the North Charleston Athletic Center, with free bike helmets for those who register, and a lot of good information about injury prevention for kids and adults at that event on the 15th, sponsored by the City of North Charleston as well as MUSC. And then I think just above, maybe on the 22nd.
I don't
I'll-
have anything on, I didn't have something on the 22nd.
Okay, I'll just tell you about that one and I'll send it to you. So that's another Thanksgiving giveaway on the 22nd from 10 to 1. That will be at 2429 Midland Park Road in North Charleston. So turkeys and produce there. That's a week later than these others. And then this is another festival in Hanahan on the 15th. So that'll be a busy day with lots of activities around our community. And then lastly, on December 1st, every year we have an event to honor those living with HIV, as well as those who have passed away due to AIDS. This event this year will be at 6:30 p.m. in Mount Moriah Missionary Baptist Church. That is in North Charleston. And we would love to see many of you there. I think it will also be live streamed. If that's the case, I will share that with Paul, but I'll be there in person and would love to see many of you as well. So lots of activities coming up in November and the 1st of December.
Great. And I'll reach out to Linda Ballinger. She put some things in the comments, but if you want to talk about those, you're welcome to, please.
I was just going to mention that we actually have 2 Mount Pleasant schools that are going to be having wellness fairs in November as well, with the Vision program. I can't learn to vision to learn.
Vision to learn.
Yes, that's it. They're going to be there, but Beckham's is this weekend on Saturday. I put the link in there, and then Wando has one the evening of the 11th. So super excited.
Great. Thank you for sharing that. Any others that are coming up that anyone wants to share? Well, thank you for sharing all those events. A lot of busy stuff. Paul, did you have something?
Well, the big one this weekend, there's 2 things.
Yeah.
We have a steeplechase horse race going on at Hollywood, but we have the Kids Run and Family Festival, a free festival, November the 9th, Sunday, from 1 to 5 at Stony Field. With daylight savings time, usually the runs would start at about 4 o'clock, but they're actually going to probably start a little earlier. So, but there's plenty of arts and crafts and jump castles and fun things for the kids for 3 or 4 hours. And then we end with a fun run that it's based on the child, how far they run. And there'll be a little mascot run out there from the local colleges. And just a good time, a free event, but it's a children's festival at Stony Field, which is right next to the River Dogs Stadium, between the River Dogs and the Citadels football stadium. So please share the word and welcome everybody in.
Great. Thank you, Paul. Any other events coming up this month that anyone wants to share? All right. Well, if not, we've got 2 sets of minutes to approve. We have our September 3rd minutes and our October 1st minutes. Paul sent those out earlier this week. Can I get a motion to approve those minutes, please?
I'll make a motion.
Thank you. We got a motion to approve. Can I get a second?
Second.
Thank you. We got a motion to approve the minutes and a second. Any additions or deletions? If not, all in favor of approving the minutes, please say aye. Aye.
Aye.
Any opposed? The ayes have it. And we'll call back on Dr. Katie Richardson for our community health update.
Thanks again, Councilman Shealy. I thought I'd start with measles. Hopefully, you have heard it in the news, and we are certainly using this time to highlight the importance of the MMR, the measles, mumps, and rubella vaccine. It is highly protective against measles and is available for children and adults at pharmacies and your provider, as well as at the health department. Beginning on September 17th, South Carolina moved into an outbreak status for measles. We'd had several cases associated with travel earlier in the year, but about now, a month and a half ago, we began seeing cases in the Spartanburg area. We now have 34 cases associated with that outbreak. Thankfully, no new cases since Friday, and the most recent cases were seen in family members of those that we knew to be positive. So thankfully, they were already isolating at home. We have one case in Greenville County, but all have otherwise been in Spartanburg County. All but 2 of those cases were in children and adults who were unvaccinated with the MMR vaccine. 2 were partially vaccinated, but what we call not up to date. So did not have the number of vaccines we recommend. Only had 1 vaccine and could have had the second one, but had not. And the vast majority of these have been children. Paul sent out, I think yesterday, some information on who needs an MMR vaccine. For those born between 1957, you're presumed to be immune, just because pretty much everyone had measles prior to then. After that time, the MMR vaccine was generally given or began to be given. And so those born after 1957 do need at least 1 dose of the MMR vaccine, or they can get a blood test that shows immunity to measles. 2 MMR vaccines are recommended for all children, all healthcare personnel, anyone traveling internationally or to areas where there's an ongoing outbreak, college students, and women of childbearing age before they become pregnant. And then there's one last category, and those who were immunized between 1963 and 1967. It's actually a different formulation of the vaccine, used a killed virus instead of the sort of live virus vaccine that we currently use. And so that group may need another, or we recommend they receive another MMR vaccine if that's the only one that they received, just to make sure they have the most effective version. We do have an immunization registry in South Carolina that's called SCION, and anyone can go on and look up your immunization records, but it's only as good as what your provider has put in to that registry. So you can confirm your vaccinations there, or find your vaccination cards with your parents, or that you may have gotten it since then, or like I said, can get that that blood test to look at vaccination status. But we do recommend that everyone receive at least 1 MMR vaccine if born after 1957. 2 for all those groups that I spoke with. Thankfully, we've not had any cases in the Low Country, and knock on wood, we're gonna stay that way. That's let's see. These are the recommendations depending on when you were born. There is one additional recommendation for those in outbreak situations or traveling internationally with small children. The MMR vaccine can be given as early as 6 months for those who may be at increased risk. That does not count as one of the 2 vaccines needed for school, but it does offer protection for infants during that time. And again, that's only for high risk. And that's in that second bullet point that Paul is showing now. Always happy to talk to folks if you have any questions about the vaccine and who may need it. Okay, that's measles. Flu. Thankfully, we are not seeing much flu yet, but we know it's coming every year. So now it's a great time to get your vaccine if you've not already received it. And it is also widely available, and pharmacies are your provider. COVID, thankfully, cases are continuing to decrease there. We do suspect it will rise again around the holidays. That has been the case since we saw COVID enter the scene in 2020. Vaccines are available and are covered by most insurances. And then finally, RSV is also low right now. So we're getting a little bit of a breather at the beginning of respiratory virus season. But again, there is a vaccine available and recommended for those over the age of 60, women who are pregnant. And if the pregnant mom doesn't get the vaccine, we recommend it for her infant during this time of year. Moving on from respiratory viruses, I wanted to give a quick fast track cities update. Thank you to all of you from last month for recommending that we ask Mayor Cogswell to sign the New Orleans resolution in the spirit of resilience to end urban HIV epidemics. He did agree to do that. And so thank you all for helping to make that happen and continue Charleston being a fast track city to end the HIV epidemic. As I mentioned earlier, the World AIDS Day remembrance and celebration will be on December 1st. In North Charleston. And we certainly hope that those in Charleston, as well as North Charleston and the whole Tri-County area, will use that time to remember that we have all the tools to end the HIV epidemic. We just need the will and the support of all our partners to make that happen. Two last things. One, we all know that SNAP benefits are still being held up at this time, at least as far as I know. Nick may know the latest. If there's any good news, that would be great to share. I did want to let folks know that WIC benefits, that's Women, Infants, and Children, the nutritional program that we, DPH, runs in South Carolina with, it's a federal program, is still up and running. We are open for business and open for taking on new clients. And so please consider that as one of many options and food resources in the community. And Paul and Kevin, I'm not sure if now you'd like Nick to speak or if you'd like him to speak afterwards, just about all the, what Low Country Food Bank is doing during this time of difficulty.
Sure, if Nick would like to speak, that'd be great.
Yeah, sure. No, thanks very much for letting me give updates. As Katie, as much as we know at this point in time, but all of that to say, I think, as everyone knows, I mean, we are facing a significantly challenging time. Just to let everyone know that here at the Food Bank, we're trying to do everything that we can to try and address this current situation and the increase in need that is across our communities. Just to give a little bit of a sense as to what we're seeing here at the Food Bank, for many of you may know that we do offer emergency assistance here at our facility in Charleston, and something that we've seen over the last couple of weeks now, going into this week, we've seen a 3 times increase in the number of people that are coming through our front door to seek emergency assistance. So that's from around about 20 of our neighbors a day. Now we're running at about 60 neighbors today. So again, that gives you a sense of some of the problems and challenges that our community is facing. I think that's also reflective of that's not something that suddenly happened. That is a trend that we have been seeing over the last couple of weeks. And of course, I think our neighbours have been preparing for the inevitable loss of SNAP benefits. So a lot of our neighbours have been strategically thinking about how do we prepare for that November the 1st deadline, and starting to look at ways and means of getting the support that they need so they can make sure that they have the food that they need on their shelves, at least going into November, as those benefits are removed moving forward. As far as we know, at this point in time, in terms of SNAP benefits, I think as everyone has seen, that there has been a decision made where the SNAP benefits will be partially paid during the month of November. I think one of the challenges that we have been facing is, well, how do you define partial payments? Is that going to be payments for a partial period during November, or is that going to be a percentage of SNAP benefits that are being paid during the course of November? I think in North Carolina, there has been some communication in North Carolina to clarify what partial payments mean, and that, as I understand, is 50% of SNAP payments are going to be made during the course of November. There hasn't been anything provided in terms of guidance here in South Carolina, but we are hoping that will be defined soon, and at least our neighbours will receive some form of payment during the course of November. In terms of what we're seeing on the ground, we've been working very closely with our partner agencies, and as many of you know, we have a network of 240 partner agencies spread out across the 10 coastal counties of South Carolina, who are doing an absolutely admirable job in terms of meeting that need. We did a very quick pulse survey last week to get a sense as to what the situation was. And based on some of the feedback we got, 90% of our agencies, partner agencies, are seeing an increase in the number of neighbours seeking food assistance through their pantries. And roughly about 40% of those are seeing somewhere in the region of 50 or more of neighbours coming to seek food assistance. So it's a difficult time, and I think a lot of the feedback we're getting from our partner agencies are that they're seeing a lot of need for children and seniors. They're also seeing a lot of first-time people coming to seek assistance as well, which again, in many senses, what we're seeing now is not too dissimilar to what we were seeing during the pandemic as well. So it's unfortunately a bit of a deja vu, if you like, in terms of how we were seeing the situation during COVID. Having said that, as I said, we are doing everything we can to be able to support. We are working very closely, as I said, with our partner agencies to make sure that they have the resources that they need to support their neighbours. So we are getting food out on an accelerated basis here from our facility in Charleston, but also from our facility in Hampton, down in Early Branch, and also up in Myrtle Beach as well. You will have seen quite a bit of press coverage of the situation as well. So we are doing a lot of interviews. You will have seen Governor McMaster's press conference last week and the launch of the 1SC fund. That has raised some funding, albeit, I think, just to give a little bit of sense to the 1SC fund in the past, during Hurricane Helene, I think it raised somewhere in excess of $6 million. Unfortunately, it hasn't raised as much currently as a result of what we're seeing today. But having said that, we did receive here at the food bank last night our first disbursement of funding from the 1SC fund. So all of that to say, funding is being raised and it is being channeled back to us efficiently and quickly, and it's enabling us to purchase the food that's needed, get it into the warehouse and getting out to where it needs to go. Let me just end by saying for every person that's coming in and seeking assistance, it has been incredibly humbling and just incredibly motivating to see the community outpouring of support. I mean, it's incredible. The number of people that are coming to the food bank, who are doing food drives and also fund drive as well, dropping off food here at the facility from their food drives. I mean, it's been incredible. It is pretty chaotic here at the moment in terms of taking that food, sorting it, getting it onto our shelves and getting it out to our agencies. The community is stepping up in terms of funding. A lot of our corporate and foundation partners are providing emergency support for us, which is enabling us to turn that around into the procurement of food and getting that out as quickly as possible. So there is certainly significant awareness amongst the general public and an outpouring of support for the work that we're doing as well, which we're incredibly grateful for and will obviously continue moving forward for as long as we have this problem. Let me just finally say as well, one of the things that we are saying, of course, is let's not forget, this is something that we are responding to on top of which was an already increasing need within our community. So it is not as if this is something that's operating in isolation. It is something that's just compounding or adding to the challenges that exist within our community as we see increasing food insecurity as a result of the cost of living increasing and the challenges that many of our neighbours are facing in terms of meeting their expenses, whether it be rent, transport, utilities, and having to make some incredibly challenging decisions. But as I said, as a community, I feel incredibly proud that we're stepping up and doing everything that we can to meet that need moving forward. So I'll stop there. That was just finally to say, one of the things that we are constantly asking, something that we're doing a lot about is where do people go if they want to provide some support? We continue to drive people to our website. We've updated our website. You will see there's community resource and support that comes straight up on our website. It'll take you straight to where you can support in terms of donations, whether you want to do a food drive, a fund drive. A lot of people are coming into our facility here. We have boxes that people can pick up to do food drives, special designed boxes. People can sign up to be volunteers as well. We have every day we've got 2 runs of volunteers, so we're overrun with volunteers helping everything that we do. And most importantly as well, on the website, just clicking on find food takes you directly to a very interactive and easy to use mechanism on the website to find for anyone to find the nearest food pantry. It provides information when that food pantry is open, the different types of services it provides. And it also provides you with a list of the distributions that we do. So this month we have at least 20 food distributions taking place in various locations across our service area as well. So that's probably a lot of information. So Paul, yes, you have the website there.
Yeah, and I think you can see it's lowcountryfoodbank.org /get-involved. So is where Paul's showing now.
So Paul, if you just go up to the top, if you click on find food, find a pantry near you. It's very easy. If you scroll down, you'll see the interactive map there. So all anyone needs to do is put the zip code or an address in there, and that will provide a list of all of the nearest pantries. So Paul, if you wanted to just, for example, just click in a zip code. So there you've just clicked on a zip code and you can zoom in on the map there. The 20 that is shown on the map there means that there's 20 food pantries or access points for food in that location. But on the right hand side there, as you said, you're scrolling through all of those. If you click on one of those for more information, it will tell you, if you scroll down, there's telephone numbers. And there it tells you also regular program hours as well. So there's a lot of information there in terms of being able to access food, the different pantries. If you want to go up again, Paul, you're just clicking through, go up. If you want to look at different ways of supporting as well, if you get involved, again, if you go down there, host a virtual fundraiser, host a food drive, gives you all information and guidance in terms of how to initiate that. We have staff here that can help support and provide any assistance as well. So there's a lot of very easy ways there to be able to find support, but also provide support as well.
Nick, this is Morgan. Thank you so much for this really helpful update. Is there one type of support the Low Country Food Bank needs most right now?
I mean, what we're telling everyone is, I mean, the easiest way and the best way to support is through funding, because that enables us with the flexibility to be able to purchase the food that's most needed at any particular time. It's quick, it's easy, it's convenient, and it means we can get the food that we need and we can get that out to our partner agencies as quickly and as efficiently as possible. So obviously, I know people have different ways of supporting, whether it's a food drive, but for us, financial resources are the easiest way in which we can turn that into immediate support to our neighbors.
Thank you.
And thank you all for everything you do to support as well and share the word. And I know it's difficult times, but I think our neighbors definitely appreciate it. And we really appreciate all the support that everyone's providing.
Thank you, Nick. What great work at a critical time. Appreciate all that you're doing and all your team's doing. Thank you so much. Okay, back to Dr. Richardson. Were you finished with your?
I have one. I wanted to end on a piece of good news. So I wanted to let everyone know that our Youth Advisory Council that I've spoken about several times on this call has been formed. We have a great group of high school, college, and young people ages 14 to 24, and we met for the first time on Monday. Several Charleston high schools as well as colleges are represented, and it helps give me hope for the future to hear passionate youth talking about the importance of public health, healthy communities in their lives and those of their community. So I'll keep you up to date as that goes on. We'll meet monthly for the rest of this school year with that group and hope to make this a yearly group to form and meet.
Great.
That's all I have. Thank you.
Thank you so much, Dr. Richardson, for your reports. All right, so we'll move on to our community health and wellness updates. Does anybody have anything? If you do, just raise your hand. Any updates? Okay. Seeing Quentin Tompkins, MUSC.
Yeah, Councilman Shealy, thank you for allowing me to share. Just want to let you all know that on this Friday, November 7th, our College of Dental Medicine will be hosting a Give a Smile to Veterans event. And this will be hosted right there on our campus at our College of Dental Medicine right there off of B Street. And this is for anyone that does not have a dental home. And I will drop the flyer in the chat for those folks on the call to be able to take a look at. But this is open to all veterans who may or may not have medical home or a dental home. And we'll have some other services and screenings out there as well. But it's hosted by our College of Dental Medicine. So
Great, thank you.
Mhm.
Any questions for Quentin Tompkins? Okay. All right, any other items anyone wants to bring forward on our community health update? All right, we'll move on to down our agenda. We're going to be talking about addressing teen vaping in our schools, and I'd actually like to call on Maggie Dangerfield to introduce our speakers on this, if she would, please.
Sure. Hi, everyone. We're really excited today to have two amazing colleagues of mine with us here to talk about some of our teen vaping prevention measures that we have in the district. We have Ms. Linda Ballinger, who is a member of our Department of Student Support Services, as well as Mr. Kenny Buckheister, who serves as our Executive Associate of IT. So I'm going to turn it over to them to share a little bit more about the new devices that we have in our school, kind of the impetus for that, and how things are going.
Linda, thank you, Maggie. And Maggie, I do want to say we have one additional person joining us today, John West. He is the projects officer in IT. His team is responsible for all of the construction that the district does new construction and rebuilds and redesigns. His team is responsible for making sure all of the technology is ready to go and in place when kids and teachers walk in the door. So
Wonderful. Thanks for joining, John. My apologies. I didn't see you down there in the box.
yeah,
All right.
I should have let you know, Maggie. I apologize.
That's all right.
And Linda, did you want to go ahead with your piece, or did you want us to kick it off?
You go ahead
Okay,
and
I was
I'll bring it up
afraid.
later.
I was afraid you would say that. Mr. Shealy, let me ask you. I have a short presentation about our approach with these devices, and then we thought we might give you a brief demo of the product. It's actually pretty cool. And Linda, did you want to talk for a minute about what you're planning on covering?
Sure. Where you guys are talking about the vaping from a building aspect and logistics and all, mine is more for working actually with the students, and what we're doing as far as promoting education and community awareness. So I think you're a great place to start with what the school's doing as far as
The physical and the
physical stuff.
technical.
Yeah, exactly.
Mr. Shealy, does that comport with kind of what you were thinking or what you'd like to
Sure,
hear
that's
about?
Yeah.
All
That's
right.
outstanding. That'd be great. Thank you.
May I share?
Yeah, Paul's got the control, but you can share.
All right. I think I have the rights to do it, and you might see a presentation on the screen.
Got it.
I have if it's too high resolution for anyone, let me know and I can change that. So thank you for allowing us to speak with you today about what we have going on with vaping, this new technology. So, I mean, I'm preaching to the choir on most of this, if not all of it, but we know that vaping is very common among teens, extremely harmful. According to the CDC, nearly 8% of US high school students report vaping regularly. And it isn't just nicotine. Many of these devices contain THC and other substances, and they're delivering doses that are really far higher than what traditional cigarettes do. We know that it's especially harmful for teens. Their brains are still developing, and nicotine exposure at this stage affects attention, impulse control, and mood regulation. All things we kind of want to keep in check with teens, especially. It often takes place in bathrooms and locker rooms where supervision is limited. Actually, our locker rooms are pretty well supervised by coaches. But these hidden spaces become hotspots for not just vaping, but all kinds of other activities, loitering, bullying, and the like, vandalism. And there's a real academic cost, as we all know, to this. Studies show that frequent vaping correlates with lower GPA and higher absenteeism. I've seen estimates, data that shows GPAs can be as much as a point lower for students who vape. So why do we act? Schools have a responsibility that goes beyond instruction, obviously. We have to make sure our students are safe, both physically and emotionally. And we believe that by addressing vaping early, we're protecting not only lung health and brain development, but also academic focus and emotional health. We also know that the risk of nicotine in any form escalates into other substance abuse later on. But really, the most important thing is making sure that we provide a safe and supportive environment for all students, vapors and non-vapors alike. So we would like to take an approach that's not punitive. We stress preventative. And we want to identify risk behaviors early so that we can support conversations and connect students with the right folks before the harm occurs. So we we're using sensing technology that's new, and actually it's changing the landscape of the vendors who provide this type of technology. It's a company called Triton. It's started by a couple of 20-somethings who are brilliant and entrepreneurial, and they've built an amazing company in a very short amount of time. Most importantly, they've built very, very good technology that is changing, like I said, how vendors approach this. Whereas most vendors have been sensing smoke and vaping, this team has gone much further. It not only does the traditional vaping, cigarette smoke, and THC vapor within seconds, but it is the fastest that we've seen in getting messages to the appropriate teams so that interventions can happen quickly. And it can tie into our camera systems, which of course we have in all kind of non-bathroom spaces, in hallways and such, so that we can immediately identify, even if responders aren't able to get to the bathroom quickly, we know who has come out of the bathroom just after the event occurred. So again, quicker intervention, better data, and just provides a more supportive culture around student health. Some of the things that it can detect besides the vaping, raised voices. I'll talk about privacy in a minute, but it can recognize raised voices, aggression, glass break, even words, keywords like help or emergency. But it is smart enough to not react when I ask someone to help me with my homework. It's very good at picking aggression out from regular conversation. It also monitors air quality, CO2, and temperature. So it gives us early warnings about any ventilation issues that can affect student health. And while vaping obviously is the headline, these sensors ultimately support both physical and emotional safety, which is so important. They help us identify when a space might be unsafe or when a student might need help, without ever crossing privacy boundaries. So speaking of privacy, we want to be very, very transparent with school staff, with parents, with students. When a technology like this enters a sensitive space like a restroom, the first question is always, how are you protecting privacy? The Triton sensors have no cameras, no microphones that record words or conversations, but they do detect certain keywords and certain sounds. And there's no personally identifiable data ever connected with any person in the bathroom. They detect particulates and sound patterns, but not individuals. So we're communicating with staff, parents, and students about what they do, and as equally important, what they don't do. But that privacy is a key principle for us here. So who receives the alerts? Principals, assistant principals, SROs, our student resource officers who are there to provide safety for students. And the first step is always verification and a calm response. We don't rush in, start throwing kids up against the wall or anything like that. We're not trying to catch anyone. We just want to make sure the environment is safe. And then we want to approach the students with care and confidentiality. School counselors involved if necessary. And over time, we review patterns of activity. John will show you in the demo some metrics that tell us when things occur in higher numbers, what times of day, what bathrooms, what days of week even. So that's all interesting information that we can make decisions on and provide plans, proactive planning for responding. So the early results are promising. We're hearing great feedback from the principals in which these devices, in whose schools these devices have been installed. We're getting reports from students now that they know that they are being watched. I should say listened to maybe or sensed that vaping is less common in certain restrooms now. The environment feels calmer according to staff, and we know we're reducing exposure to these harmful chemicals. We know that when students feel safer, they're more likely to come forward when they or a friend need help, and so we just feel like we're supporting a healthier culture. So next steps, we're in a phased rollout now. We started about a month ago. We are installing in high schools. We will be the rollout will be complete by the end of this calendar year, by the end of December. This is kind of just the beginning for us. It's going to be really interesting to see the kind of data that we can collect and the kind of proactive steps we can take to hopefully reduce vaping among teens. Any questions on any of that before I turn it over to John for a quick demo? All right, John.
All right, Kenny did a great job. I'm going to share my screen very quickly, Paul. So this is the user interface that our administrators see at each site. As Kenny said, we've got the ability to send alerts to phones, cell phones, district cell phones throughout the building so that they can receive alerts quickly, especially if they're out in the hallway dealing with other issues. But this kind of gives you the information that they would be seeing to help them put a plan together to fix vaping. So this is North Charleston High School. So we put these in about 2.5 weeks ago. They've been using them and loving it so far, but it's kind of telling us that these are the vaping incidences that they've seen. And you can see by date that we're starting to trend downwards. And this week we've got 8 so far. So the idea is that hopefully this will continue in this trend where once they realize that this is something that you can't do regularly on school campuses, that we'll see this limit itself. Now, this allows the school to see where the incidences are happening most frequently. So the 3rd floor bathroom on the ROTC side, they know this is a hot spot. This is where these kids are going to do this because they feel the safest, or they don't have as many classrooms around or whatever. They know that this is happening, and they can see bathrooms that aren't as large targets for this kind of stuff. Also,
John,
they can
is
see
that timeline since installation.
Yes, sir.
127
Yes, sir.
cents. Okay, very good. Thank you.
Yes, sir. So this kind of gives them an idea of, and I can drill it down. So the beauty of this is I can take it by day and we can see it by day. This is just giving us a bit of a broader idea of what it is. And then we can see times of days that are more problematic. And then we have a heat map. So this is telling us what time of day, what bathroom, where we're seeing the most activity. This is crowd count, but I can change it to vaping. But this will tell me also if they're using THC, if it's a standard vape, if we've got the help sensors or crowding or whatever. And then the other part of it is I can see in real time what's going on in each of these spaces pretty broadly. So for example, this is a bathroom that has 2 students in it right now. I can see the air quality index is very unhealthy at the moment. So I'll let some folks know about that. But this shows us the students that are in the room. So it'll just tell us how long they've been in there. And if it starts getting to the point, and all of this is programmable by the school, what they set as their parameters, they can say, we don't want folks in these bathrooms more than 8 minutes. I want an alert if they've been in there skipping class or doing whatever. It can give them an alert. But this shows you real time this person's moving around this bathroom. So I can see that in any restroom throughout the building and see who if there's something going on that we need to check on, vape or otherwise.
And that's something I didn't mention, that loitering in the bathroom can point to several things. A child might be in mental distress, or like John said, maybe just not wanting to go to class. But then if you have large groupings of students in a bathroom, that tells you that something that we want to know about might be going on. So that's great metrics there.
Absolutely. Is there any questions I can answer? All right, I'll hand this back over.
Great. Ms. Ballinger, did you want to take it from here, or are we going back over to Mr. Kinney?
It's all Linda's now.
Okay.
All right, thank you so much. I didn't realize it did all that, so I am like ecstatic and definitely want to look at some of the data to see what we can do for the ones that have the higher incidence of vaping. Currently, with the substance use support program for CCSD, we do a lot of prevention work and through 5 strategies, which is information dissemination through all the schools, and that can range from anything about making them aware every month of what programs are going on, or awareness months those are, and making sure we get the information out to the schools. And we also do education, both with the students, the faculty, and with parents and community members based on different issues and concerns that we're seeing throughout. And we do problem identification and referral. So going in and working with schools, looking at that specific school's data and coming up with a comprehensive plan for them as to what they can do to also look at all these strategies. What can we do as far as getting the information out to, if the problem, we're seeing a lot of 8th graders having infractions, of what we can do to get in the schools for the 5th graders and 6th graders so that they can be educated before they get to middle school, and looking at doing some parenting programs. And as I mentioned, just awareness for the staff as well. We do a lot of community-based processes and environmental work as well, being on different committees and just making sure that we're getting the word out there. So that's kind of what we do from a prevention standpoint. When you're looking at the students that may get an infraction for vaping, what we do, just as with Mr. Buckheister and Mr. West, we don't want it to be punitive. We want to make sure that we get these students help. So we try and talk about the programs and what we can offer as far as the students that get infractions. And what we do is, generally when we get a referral for support from a school or from a parent, or it could be from one of the school counselors or administrators, regardless if they've got an infraction or not, if a student says they need help, is we go in and we do a screening on these students. That is the Craft-In screener, which has a huge portion of it that just got added a couple of years back on nicotine. And we do the screener, and based on what the students tell us of how often they're using, have you ever tried to stop? Do you use at school? Making sure that they know this is confidential information. It is to offer support and not to be punitive. We usually have a very good rapport with these students who are honest. And we take that information and decide what is the best supportive intervention for those students, whether it be an educational program. And we do use a program called Everfi, which is an online educational program. And we also use one called Drug-Free World. And we also use the Stanford-based programs. If we find that those students need more intervention than just an educational program because they're using more often, then we look at putting them into a level 2, what we call, which is working directly with a counselor or a mental health and wellness coach. And in most cases, it's going to be the school social worker who actually sits with them one-on-one to complete the Stanford program, which is all research-based and evidence-based. And those students who we feel, and again, they're all going to continue to get that level 1 supportive education as well. So it's like a tiered. Those students that we find score higher on the craft, we offer referrals to outside agencies, whether it be Charleston Center, MUSC, Just Say No programs. We work with them, and also the Family Tree, and make sure that we get them and give them as many resources as possible. We also started kind of like a little helpline called ADAPT, which is the program that I run, Alcohol and Drug Alternative Program for Teens. And it's called ADAPT Quit, where students can email us and we can get them the information that they need on different resources to quit vaping. And that could be vaping THC or electronic cigarettes. And so we offer, like I said, many, many different strategies to help these students who are either asking for help or who have gotten caught with electronic cigarettes or THC vapes on campus. And we've had a lot of success. We work very closely with school support, the Department of School Support, also known as DOS, with their Turning Point Academy, as well as the alternative programs at Daniel Jenkins and Liberty Hill. So we're one of the best kept little secrets, I think, for the school district. But that's me and just how passionate I am about the program. And we work very closely with Charleston County Medical Society as well, and some of the community agencies like Act Force that was headed by Judge Brucey Hendricks, and it's a lot of first responders. And as we mentioned, we just got, as Katie mentioned earlier, we did just get a $500,000 grant from the Public School District's Opioid Trust Fund, which not only covers gateway drugs, which we still call them, but has a large influence on opioid use as well. So we're doing a lot of moving and shaking behind the scenes. And so that's a lot of information in a little bit of time, but we are open and available to do any type of community events. And we work very, very closely with health fairs in the community, with a program. It used to be South Carolina, I forgot what it's called now, but it's changed names again, but doing the Screenagers program, which is a great documentary that not only focuses on social media, but on vaping and just substance use and mental health and wellness, as well, as they go hand in hand. So any questions about a lot of information, a little bit of time?
Kevin, just one question. Linda, I know most of the schools have health and wellness courses or curriculums now. Does this get integrated into there, what y'all are doing with the smoke, with the vaping and all?
Yes, I work very, very closely with Holly Cutt, who is in charge of all of the health and PE and educational programs, and Everfi is used. The vaping program and the mental health and wellness program are both used in those classes and available. And Holly's done a great job of putting information out there for these teachers on different curriculums they can use. And like I said, when we know that there's an event or an awareness coming up, like the Great American Smokeout is this month, we always make sure that we get everything that teachers need or that the schools need as far as promoting these events, whether it be fact sheets, resources, the cessation programs for vaping and all, because we want to inundate them as much as possible and make sure we have that information available for not only the teachers, but the students as well, in a safe place that they feel they can go in and get the information without being judged.
And Kevin, I also want to introduce, well, we had Stephanie Stansel from MUSC was joining in with us today. She does the tobacco treatment specialist and vaping programs, all et cetera, of MUSC. So another great contact for us in our community.
Very much so.
Yeah, thank you for joining us, Dr. Stansel. All right. Any other questions?
Thank you.
Yeah. Yeah, thank you so much, Ms. Ballinger, Ms. Dangerfield, Mr. West, Mr. Buckheister. Thank you so much. What a great presentation and great work you're doing with our kids. We appreciate all the work you're doing. So thank you. Any
Thank
other
you.
questions? Is
Jennifer Brush
Paul?
has to say something.
Oh yeah, please, Ms. Brush.
Oh, Paul, that's so funny. I was sitting here thinking, okay, what am I going to say? Because Paul's going to ask me to say something. Really great presentations today, but I'm really interested. I'm actually going to send out the link to the food pantry to our whole center. So thank you for that. And the school, I think that it'll really be interesting with the data y'all have. That's just amazing. Interesting. I'm glad I didn't have that when I was in school, right? But anyway, yeah, so for us, we're just still trying to maneuver our new agency and this part, we don't really have a leader yet for the Department of Health and Disabilities. And so we're hanging in there, but we are hiring lots of positions. So anybody knows anyone who wants a position, either bachelor's or master level, we have lots of positions open, but we're just doing our best to serve our patients too. And we do have lots of folks who need food assistance, including staff. So all of this was really great information. If we are taking donations for like socks or coats or toiletries, because we have a patient party here December 6th, and we usually give out bags like that to our patients and the people we serve in the community. So I don't have any other big news. I mean, we still have our conference next year. We are starting to plan that. If I don't say conference, Paul's gonna probably make me say that too. So it's getting exciting. We're starting to line up some speakers. So all is good. All is good here.
Great. Thank you so much. All right.
Kevin, could I just ask Nick a question? Nick, Thanksgiving's coming up. People are looking to make sure that there's help out there. Any requests for us for Thanksgiving time?
Nothing more than normal. I mean, I think we're focusing at the moment on making sure that all of our neighbors can celebrate Thanksgiving with their families as they normally would do. So we have been actively focusing on the procurement of turkeys. That's something we do every year. There's huge demand and obviously the significance of being able to come together as family despite the challenges that everyone's facing. So again, funding that we're receiving is both looking at the immediate response, but also, we don't know how long this is going to continue. And as I said before, we're responding to a significantly increasing food insecure situation, even without the shutdown. So again, it's part and parcel of our daily work. And again, any resources that we receive are basically responding to the immediate challenges and issues, but also thinking about the holiday period and the Thanksgiving, especially the Thanksgiving period. So, that is significance to buy turkeys and family and being able to ensure that our neighbors have the resources and the food that they need to come together and celebrate effectively and appropriately.
Good. All right. Anyone else? Anyone else have anything for our committee? Well, if not, I want to thank you so much for taking your time to share with us. This is a great meeting, a lot of great information from a lot of great people, and appreciate all that you do. And thank you for helping make our city healthier. We appreciate all that you do. Thank you so much. If there's nothing else, we are adjourned.
And congratulations, Kevin, on being reelected.
Thank you,
Yes,
Paul.
congratulations. Councilman.
Congratulations.
Congratulations and thank you, everyone.
Thank you to our speakers.
Thank y'all.